Healthcare reform is going to take steps to try to fix some of the broken, backwards-ass things in our system. First, I'll go over what the healthcare reform legislation is proposing. Then I'll go over some of the myths in the media.
Hello! Wow, this is pretty fun actually. Wow, nice. So this is the proposed bill in the House of Representatives, H.R. 3200. Now remember, the Senate also has to propose their own bill, then they have to merge it. H.R. 3200 improves access, affordability, quality, as well as lowering costs for taxpayers. No one is gonna lose health care or be required to change their health care because of the reform. Obama promised, if you like what you have now, you can keep it. Employers who do not provide their employees with health insurance will now be required to provide their employees with health insurance, except for small businesses who won't be able to afford to do that. Small businesses with a payroll under $500,000 will be exempt from this new employer mandate. Businesses that do not meet criteria for the $500,000 payroll exemption will be penalized if they fail to provide health insurance for their employees. The penalty will be based on a sliding scale from 2% to 8% based on the business payroll. Small businesses with a payroll over $500,000 may qualify for tax credits, which can assist them in securing health insurance for their employees. Employees of small businesses who are exempt from the employer mandate can secure their insurance through what is gonna be called the Health Insurance Exchange. Self-employed and unemployed individuals who do not meet the criteria for qualifying for Medicaid are also going to be able to get their health insurance by participating in the Health Insurance Exchange. So what is this Health Insurance Exchange? Well, it's a list of different insurance plans that can easily be compared, that the people who need to use the insurance exchange can look at, and it'll be transparent, and they'll be able to see the cost of each plan and the benefits with each plan. One of those plans will be the public option. That's a way that these people are going to be able to get their health insurance. Now, some people are going to be eligible for sliding scale affordability credits to help pay their premiums. And it doesn't matter whether they're getting their insurance through their employer or through the healthcare exchange. These sliding scale affordability credits are going to be available to the lowest income members of our population who do not qualify for Medicaid. Every plan in the Health Insurance Exchange is going to have minimum guaranteed benefits that are covered by the plan. These include inpatient hospital services, outpatient hospital services, physician services, equipment and supplies, preventative services, maternity services, coverage of prescription drugs, rehab services, well baby, well child visits, dental, vision for children under age 21, and mental health and substance abuse. Sounds pretty good, no? That's much better than what we have now. Another amazing attribute of the guaranteed benefits package is that for services that are preventative, that are proven to save lives and prevent diseases, such as things like well baby visits, well child care visits, mammograms, pap smears, colonoscopies, those are going to be free. There's no co-pays for them. You don't have to pay anything for them. Right now, I still have patients who have insurance but don't get their colonoscopy because they have to pay $250 as a copay to get the colonoscopy. Now they'll get their colonoscopy for free, and it'll prevent people from getting colon cancer, and it'll actually save lives. The next awesome part of the guaranteed benefits package is that you cannot be rejected from a plan for pre-existing conditions, and there's an annual cap for out-of-pocket spending. Amazing! Now for a very integral, important part of healthcare reform, the public option. No one is gonna be forced to sign up for it. It's just another one of the optional plans that you can sign up for in the health insurance exchange. And when the public option offers quality care for an affordable price, it's going to force the other private insurance companies to compete with it. And if the private insurance companies want to keep their customers, they're going to have to offer more honest plans with affordable prices and quality services. The public option will get startup funding from the federal government, as well as from a surcharge of the nation's 1.2% richest people. Here's a breakdown of the percentages of that surcharge. Legal immigrants with green cards will get health insurance. Undocumented immigrants will not get health insurance. So those are the basics of HR 3200. And as you can see, by providing health insurance for every segment of the population, it improves access. And by focusing on primary care and prevention, it improves overall health. Click here to proceed to myths of healthcare reform.